Hello, everybody. Welcome back to the Connected Wellness Podcast. I am your host, Rachel Ann, with a lovely host, Marianne, and our lovely guest, which we're going to introduce in just a little bit. And we are all so passionate about wellness.
Here in this podcast, we look at the ways our physical, emotional, and spiritual health is all connected, and how we can take better care of our whole selves holistically so we can live our best lives. We're really excited that you're here with us on the journey. Welcome to episode 23 of the podcast.
Yes!
And welcome to Dr. Mina Ayoub. We're so happy to have you as our guest.
Welcome!
Thank you guys. I appreciate it. I'm so blessed to be here.
So, a little bit about Mina or Dr. A. We go way back. I mean, how many years ago it was that you were in Pittsburgh?
Like maybe 7. Yeah.
Okay.
At least
Anything like pre-COVID is like 100 years ago. So it's been a long time. Yeah. So let me tell you a little bit about Dr. A here. So he spent most of his years up north, trained at the University of Pittsburgh Medical Center, hence why I was so lucky to meet him. He trained in internal medicine. He's a board-certified physician and proud member of the American College of Physicians and the American Medical Society for Sports Medicine. So he left Pittsburgh in 2020 because a lot of people do that because Florida, right, for the weather and the beaches and all that good stuff. But he, yeah, there you go, right? And he now has a practice called MD-PRP Wellness. So you might need to tell us about the PRP, platelet-rich plasma therapy. But the mission of the practice is to provide quality, natural care for our patients for a more fulfilling and healthier life. So that sounds right up our alley for sure. So we're really excited to have you here, Mina, and I'm excited for what you're going to share for sure.
Oh, thank you so much. I appreciate it. Well, thank you for having me here. And I listened to, more than a couple episodes of your podcast, and I really love what you guys do. I think it's nice, and I like the vibe. So, thanks for letting me be on this for sure.
Definitely.
We're glad you like the vibe, as the kids say. Good to know that we're hip. We have good vibes. Yes.
No, yeah. The vibes are amazing.
So speaking of vibes, let's start off with positive vibes and talk about some wellness wins. Who wants to start us off?
You feeling up for it, Mina, or would you like us to start it off?
Sure, I can start off. Yeah. So my wellness win, I would say a couple new things transpired in the last week. One of them was actually just making my own, elderberry syrup. I don't know if you guys are familiar with elderberry, but it's a very potent anti-inflammatory and immune berry. And I just was experimenting, made my own syrup. A lot of people liked it. I liked it a lot. And then I made it and mixed it with this thing called sea moss, and sea moss is like it's from the ocean, usually in the Caribbean islands, and it has like over 92 minerals. And really, I used it for like a week, and I just felt more energy, less inflamed, and I felt really good. So to me, that was like a wellness win because I felt, doing this. I made it myself. I made the sea moss gel, put my elderberry syrup in it, and it was really a really cool thing. I really liked it, and I ate all of it, and I was really sad that I didn't have any more sea moss.
Wow, where do you get sea moss from?
So, like you can get it actually from like natural food stores, but where I got it was at a farmer's market where the guy, he's actually very into holistic medicine, into whole foods like in general. So he gets everything from a source where they grow it from the farm. So he got it from St. Lucia in the Caribbean.
Yeah.
And so he like sources it from there, and it was really cool. But they have it at the grocery stores here too. You can get it, maybe your local like natural food store. But and it's really, it smells like minerals.
Yeah.
But it looks like seaweed, but not green. That's what it looks like.
So I do know a pretty good patent attorney. If you want to, make up this sea moss elderberry concoction, that sounds great. I would definitely give it a try. Yeah.
Yeah,
Yeah.
hey, I will I might have to ship you guys some.
Yeah.
Oh,
That's
please
awesome.
do.
That's a good
Yeah.
one. Yeah. Cool. How about you, Rachel?
My wellness one, it's not as cool as sea moss, but I am still very jazzed about it. I forgot what episode it was, but I shared that I discovered that my local grocery store has flowers, and they're just a cute, small, petite flower, like bouquets, and they're just very nice. And I'm like, I'm gonna do this. And so I went grocery shopping last week, and I was like, let's go see what the bouquets are like. And I got like a really, really cute bouquet, and I posted on Instagram just to be like, oh my gosh, look at this really cute thing that I keep doing for myself. I'm going to keep doing this. And then my husband was like, wow, this is really beautiful. Look at what it does to our home. And then environmental wellness was improved. If you tuned into last episode, you know exactly what that's about. And so it felt good to just do something kind of consistently. Because I don't know about y'all, but like I'll do something that's good. And then I'm like, okay, that was fine for like a season. But I was like, what if I just want to consistently do something nice for my home? Like,
Mm-hmm.
really cheap flowers that are pretty. So that's my wellness win, is that I think I'm gonna make it a thing to
Mm-hmm.
buy flowers for my home, and it makes me
Nice.
smile.
Yeah, and there's something to be said for little rituals too,
Mm.
like that make you feel good. So yeah, that's awesome. Good for you.
Yeah, thank you. How
What
Thanks.
about
kind
you,
of flowers?
Marianne? I'm sorry.
What kind of flowers?
They're actually. Let me see if I can. The art of technology.
Oh,
Oh, there we
yes.
go. So it's like a big like sunflower, and then
Oh,
there's like a few like red sunflowers with like yellow at the tip, which is really neat. And then there's a rose on the back end that you can't see by the wall.
nice, nice.
Some fall
Yeah.
vibes, those colors for sure. Yeah, yeah.
Yes. Yes. Fall vibes. That's what we're going for. And it's like a bright fall, which
Yeah.
I was like, ooh, yeah. Let's like be excited fall. So yeah. How about you, Mary?
So last week, Chris, my husband, had a conference in a what I thought was a super random town. Do you guys know anything about Lancaster, PA?
Yeah,
Oh, did you spend time? Okay, so maybe this is not
I
going to
grew up in
sound
Harrisburg.
weird to you, but like, okay, all in my head was Lancaster is like farms and Amish people. That's what I had in my head. But Chris had
Mhm.
this conference and I was going to tag along. Lancaster City, like the downtown, is super cute and hip and like unbelievably nice. So I took a few days off work. I passed off my classes. I did some virtual classes and I really enjoyed just like wandering around this. It's honestly, I when I looked it up, they called it like a little Brooklyn. Like that's how good it is.
Wow.
Like the coffee shops,
No.
no,
You go
I'm
to
Sorry.
are so good.
Prince Street Cafe.
Yes, Prince Street Cafe. We did go there.
Yeah,
Yeah, the coffee shops are amazing. Like
yeah.
Chris is the biggest coffee snob, and he was so impressed that we came home with bags of coffee. They have an
Oh,
amazing central market, like with all of these cool foods. I had like the best acai bowl for breakfast one day. Like
Yum.
cute little boutiques. Like so, my wellness win, I guess, is that I just really enjoyed this like not scheduled time for me. Like pretty much
Mm.
all of my time is very scheduled. Like I'm at this class, at this time, I'm prepping at this time, I'm advising at this time, I'm working out, I'm food prepping. Like it's all very like regimented. But I just had these few days where I could not really schedule anything. I
Mm.
wandered the streets. The weather
of
was
like,
amazing. I did, I shopped. Like it was so relaxing. It was so nice. So thank you,
Wow.
Lancaster. I never would have thought like I'd want to go back, you
you
know.
know,
Yeah.
I grew up in like 40 minutes from there. So,
Yeah. So have you
Cool.
like spent time there? Was it always that
oh
cool?
yeah, like Lancaster. So like Lancaster's so cool because there's a lot of good hiking there too, like the Turkey Hill Trail. Like just when you go up the mountains too, you'll go. Sheets. We have Sheets in Pennsylvania. It's
Mm-hmm.
like a gas station similar to Wawa, and there because they have so many Amish, they'll have a horse and buggy like designated
Yeah,
spot
yeah.
at Sheets, and it's just like I'm like, yo, like that's so cool.
Yeah.
Wow.
Yeah, I loved it. Like literally I was like, Chris, you're going to this conference next year because I want to come back to Lancaster.
You're
Like
gonna have to come back. Yeah.
yeah,
Wow.
so yeah. That's
That's
a
so
big
Little
one.
Brooklyn. I'm like, okay, the New Yorker in me is like, I must investigate this for
I
myself.
literally
But I
Googled,
love that.
like, I Googled, why is Lancaster so hip? Like, so I was
Uh-huh.
like, what is happening? Like this, some it just didn't mesh with what I expected. But yeah,
Yeah.
it was a good
Yeah,
time.
That's so cool. Okay,
it's cool.
Lancaster. I'll
Yeah.
add it to
Yeah,
my list.
So yay for wellness wins, everybody. High five. High five.
Yay!
Okay.
Yeah.
So, all right, but let's get down to business here. So, we wanted to talk with Mina because, well, you brought me this topic and it couldn't have been better timing because I was literally thinking about it for my own personal reasons. Like, I think I might need to
Mhm.
work on inflammation. So,
Mhm. Same.
tell us, Mina, why did you think this was an important topic and why is it such a buzzword like these days in the wellness world?
yeah, for sure. I think inflammation is definitely a buzzword nowadays. And when I think of inflammation, I think of the root of all evil. Like I always kid around and say inflammation is the root of all evil, you know? But with that joke, there's a lot of truth. And basically, when you think of inflammation, you think of I like to classify inflammation as like acute, like something very, you get injured.
Hmm.
You are gonna have inflammation. It's gonna be normal. You're gonna be like, ow, and then your arm might be swollen because you fell on it. Then it goes back to normal. So that's a good inflammation,
Hmm.
right? But the inflammation that we're talking about really is chronic inflammation, something that's
Mm.
lasting 3 months, over 3 months, usually 6 months plus. And that's the inflammatory process that everybody doesn't want to have. And many of us, many Americans, with the American way, the lifestyle, the diet, we do have inflammation. So when we think of inflammation, not something acute, but we think of chronic. And to me, like you have inflammation here, and then you have this like this 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 disease process that stems from it. And one of it is like heart disease stems from inflammation, cancer, Alzheimer's, you even have pain,
Hmm.
arthritis, acne, diabetes, autoimmune disease, even lung disease or asthma. Those can all stem from inflammation. So when we look at inflammation, it's like, what is the cause of inflammation and how do we prevent it from happening?
Hmm.
You know?
Mm. Wow. Ooh.
So yeah, so I can definitely talk about that. But when we think of it in general, it's like inflammation. There's two big things for inflammation. There's reactive proteins in our bodies, and these reactive proteins they kind of like allow us to be in maybe chronic pain or
Mm.
have heart disease or because of high cholesterol, that's an inflammatory thing, right? Or diabetes is inflammatory disease. So all of this stuff is inflammatory, and then you also have the biggest hormone of all, cortisol.
Hmm.
And cortisol is a root of all evil too, and that's inflammatory too. Now cortisol is not bad if it's acute inflammation, right? If it's something we felt, cortisol is going to be elevated. If we're stressed, it's going to be elevated for a bit. But if it's chronic, that's when we run into issues.
Hmm.
Mm.
So that's like a brief
Wow.
intro. I don't know if that kind of covered the intro part. If you saw any questions about that part, I can definitely, get into that.
Well, yeah, my question is like if someone has not reached any of those like disease states that you mentioned, how would you know if you're kind of approaching chronic inflammation? Are there like some
Mm.
initial symptoms? I feel like we
Yeah.
all have like random symptoms here and there that we don't know where they come from, right?
Yeah.
Could that be inflammation, or can you say like how would I know if I need to deal with inflammation?
Yeah, for sure. That's a really good question. So basically how we know if we have inflammation. So before we get to this disease process, your body is fighting it 24/7. So our bodies are basically going through this process of fighting inflammation. You might be in an inflammatory state, but you're not in a disease state. You're just in a chronic inflammatory state. And some ways to know it is, for example, like someone is anxious, someone is constipated, someone has pain, right? Or you're always feeling tired. Like, I'm going throughout my day, I get 6 hours, 7 hours of sleep, 8 hours of sleep, but I'm tired in the middle of the day, right?
Mm.
I'm having pain for no reason. Even loss in, sexual pleasure, like things of that nature. That can be
Mm.
stemming from inflammation. Also, the big thing that really comes to be is that or just our skin, right? If you feel like you're not radiant, right?
Mm.
Things of that nature, or you're breaking out. It's a wide array of things. Or I'm not losing weight, right? Just the fact that, hey, why am I I don't eat, but I'm not losing. You have a lot of people say it nowadays, like, hey, I'm not eating, but for some reason I keep gaining weight.
Mhm.
That might be a chronic inflammatory process, or my skin is just not clearing up, right?
Mhm.
So it's all these things that we don't think about, but then over time, usually that person is doing one thing wrong, or two things wrong, or a couple of things wrong, and then that inflammatory process becomes a disease.
Yeah.
And whether that disease is a heart disease, sudden heart attack, you're like, oh my God, I didn't know, right? And it's like he was 45, but maybe that person actually lived with an inflammatory process for about 10 years, but to them it was just, I'm getting old, right?
Mhm. Mhm.
Or things of that nature. And it's like, oh, we're just all getting old, and that's how it is, right? But that's not really the how it should be, in my opinion.
Mhm.
Wow. I have 5 million questions, but I know Marianne does too, so I'll let her start.
Well, I just want to know because if you don't know, Mina, I teach statistics, so I like need data. So how could I test to see, like, is there a test to know if I have some high inflammatory response? Is it
Yeah.
something that's normally tested, that I could just ask my doctor or what?
Yeah, so that's a great question. So in my practice, what I do is test for inflammation. Say a 30-year-old comes, or a 35-year-old comes, or anybody who's like, in that stage. And usually my patients, they come, initially a lot of them come wanting PRP, which I can get into PRP later and what it is, but they come into wanting PRP, which is platelet-rich plasma, and we look at why they have pain, and we offer them inflammatory testing to see if we can give them PRP as a treatment, but at the same time look at their inflammatory signaling. So the main things that we look for inflammation is, one is cholesterol testing.
Hmm.
Just cholesterol testing, but it's an advanced form of cholesterol testing. So we take your cholesterol and we further stratify it by particle sizes. So we have the LDL, for example. That's your bad cholesterol. The LDL can be classified as total LDL particle number that's large, medium, and small. So and that right there is an inflammatory marker. Then we look at something called high sensitivity C reactive protein, which is called HSCRP. So HSCRP should be below 1, but we'll have some people. I have a patient just last week, 35 years old, and hers is 8. So that's a big sign of inflammation right there, right? Then you do diabetic screening. You can do hormone screening, right? Your hormones can be depressed or they can be low, and that's also a trigger of inflammatory process. Then we have these other acute things like a sediment rate. We kind of see how your blood like becomes like is it forming a sediment, like kind of like when you back in the day, I don't know if you guys have electric cars, when we used to have these oil cars, right? You take it and you're like, the dipstick has some sediment on it, right? It's like kind of the blood can have that, and there's a way that we can measure that. And our blood, if it has sediment, that's a sign of inflammation.
Hmm.
So we have this whole array. And then vitamin testing, absorption testing. Are we testing for your B vitamins, your vitamin D level? Like vitamin D is closely correlated with inflammatory processes, right? So we test those, and then the hormones. So I think with all that, you really give yourself a good overall picture.
Hmm. S-
Wow.
Would a
And then,
normal doctor like do these, or do you have to see some sort of specialist?
so it depends. Most people do not test advanced cholesterol testing,
Mm-hmm.
and then we also go with the thyroid, right? The
Mm.
thyroid's a big one, for example. But when the thyroid, we look at the thyroid antibodies, we look at the thyroid, the reverse thyroid. It's things that people are like, we might overlook this, but do you have any antibodies to your thyroid? Because you can have normal levels of thyroid hormone, but you can have antibodies. That's something creeping up that you might be hypothyroid in 4 years, but
Mm-hmm.
you're just having a little bit of the symptoms now. And then it's going to, manifest as a disease process, right? In 4 years, but over in the next 4 years, you're like, dang, I've been suffering. And finally, someone told me I have hypothyroid. It's not because other
Mm.
doctors were not paying attention or they didn't care. No, it's just because you were living with chronic inflammation and then bam,
Mm-hmm.
your body is done fighting and then your thyroid hormone goes down,
Mm-hmm.
right?
Yeah.
So things like that. And then we look at the minerals, we look at, like I said, the hormones. And then the other important thing that we look at is like uric acid levels. Uric acid is correlated with gout, but even uric acid can be a little bit elevated in some patients. That's a sign of inflammation.
Mm-hmm.
So,
Mm.
and then your iron levels, and then those are normal things. But the things that we take beyond is we also measure a protein called LPA2 activity, and that's inflammation inside the heart vessel. So,
Mm-hmm.
inside the heart vessel, not only the heart vessel, any blood vessel, we look at that. And if that's elevated, that's also another sign of inflammation.
Mm-hmm.
So, there's a lot of these inflammatory signals that we really look at for patients, and everybody's different. There's not really a clear cut for one person versus the other. Everybody is really different. Some people with genetic abnormalities, we might test um, oxidized LDL, like LDL, which is your bad cholesterol, and we see if it actually became exposed to oxygen, and that's a predictor of heart attacks too. Or
Mm.
myeloperoxidase, which is another oxidative. You kind of have these antioxidants and you have oxidative radicals, and they kind of antioxidants are good, the radicals are bad,
Mm-hmm.
and we
Mm.
test for that as well.
Mm-hmm.
So there's so much that we can test for, but not everybody gets all the testing per
Yeah.
se.
Yeah.
Hmm. Wow. I feel like, I mean, if I understand correctly, it sounds like if you are somebody who's dealing with some type of kind of minor issue, but maybe it's lasting a really long time, or maybe if you're saying like, oh, it's just because I'm getting older, that might be a sign that there's some inflammatory issues going on, and you may want to seek additional care. Is that accurate?
Yes, for sure.
Okay, gotcha. Something that I have heard a lot, and I would love to hear your thoughts about, is the correlation between mental health, emotional health, and also specifically inflammation. So, something that I deal a lot with my clients, if they have a history of trauma, there's typically chronic inflammation that they're dealing with, whether it's IBS, even like PCOS. There's a lot of inflammation that goes along with that diagnosis, and like the correlation with their cortisol levels being really high. So
Mhm.
I don't know if you have thoughts about the relationship between our mental health and our inflammation, but I would love to hear more about that and what you think.
Yeah, no, that's a great question. By no means I'm an expert in any trauma or mental health part, but I dabble a little bit in it, if if I can say, like in terms of
Yeah.
just like our foods, right, and what we eat.
Mm.
And I do. There's a very big positive correlation and a negative correlation if you're looking at it the other way, but there's a big correlation with the foods that we eat and our mental health. For example, some foods can provoke anxiety, right? Some foods can actually provoke like you have these doshas, which are the body's energies, and that's like in eastern medicine. And you have this like vata, which is like the driving force of the nervous system. And some people are primarily vata, they're like the skinny type of people, and they think with the air, and they just have this like they're just like they there's some things that will get them anxious really quick, like
Mm.
fatty foods or just like oily foods, things like that. And then you have this like energy that's like a pita, and the pita is kind of like this like middle energy, and that's like a fire energy in a way. And the pita is like a medium build, and there's some things that will actually get them also anxious, depressed, and not depressed. So it's and then you have this kapha, which is kind of like a bigger, heavier set individuals. And we know for them it's like mainly like some even vegetables, like if they eat too much of raw vegetables, for example, that can set them as an imbalance, right? So I think that's just like dabbling, like kind of like just touching the surface of that. But if we look at it primarily, that yes, like mental health, like if we know there's a correlation between just like high fructose corn syrup and depression and
Mm.
ADHD, right? Just that, or sugar, right? Too much of the sugar. Like, we know there's these correlations, and food, it really is healing for our bodies. So that's why, like, even just like every layman knows it. It's like a mom doesn't give her kid sugar at night, right?
Mm-hmm.
They're gonna go crazy. They're gonna be off the roof, or like sugar at all, for example, and that, or caffeine, right? Caffeine can be a stimulant in that way. So it's just there is a very big correlation between the foods that we put in our bodies and how we really respond to it, in my
Mm-hmm.
opinion, and how we do.
Yeah. I
Mm.
attended a great seminar on like the gut brain and like the gut mind connection.
Mm.
And yeah, that was huge about how like there's, I want to say there's like more neurons in our gut than there are in our brain or something like that. It's just crazy. And how like there's more serotonin that's produced in the gut than in the brain. So it's like a huge connection, like you said. And that's why I love
Mhm.
whenever we talked, we had a holistic psychiatrist on here, Dr. O'Leary, one time, and he really talks to his patients about everything, all the dimensions of wellness. And that should be one of the things. Like if someone comes in depressed or
Mm.
anxious, you should probably talk
Mhm.
about their diet. Like maybe that's not going to
Mhm.
cure their depression and anxiety, but it could be a contributing factor, for sure.
Mhm.
Um,
For sure.
and then the other
Mhm.
thing I wanted to say, those interesting words that you used, was that a little bit of I'm probably going to mispronounce it, Ayurvedic medicine?
Yeah, Ayurvedic medicine.
Okay,
Yeah,
yeah,
exactly. That's a little bit of that. Yeah.
like the kind of ancient Indian practice. Yeah, I mean it's really fascinating, like the connections that have been made for thousands of years and like known for thousands of years. And now, we're like, oh, maybe we should pay attention to this. Like this
Mm.
could be helpful.
Yeah.
Yeah,
Yeah.
I think it is important. I think what you were saying, what you just said, like, is very important, really, to like keep in mind.
Hmm.
Mm.
Yeah.
Yeah.
Yeah. Um, Something that I'm wondering about is like for people who are like, wow, like Mina is saying a lot of things. I'm pretty sure I have some inflammation issues going on. What is something that you would recommend that they do? Like, should they adjust their diet first? Is there a specific doctor they should see? And what are the words that they should say?
Mhm.
Do they need to Google something? So I guess like, what are some helpful
Yeah.
tips for someone who's beginning to understand like, I might have inflammation?
Especially,
Yeah.
let me just add, because I feel like you said, based on our American lifestyle and diet, we could
Mm-hmm.
probably all assume we have some
Yeah.
inflammation, maybe at a different level, but
Yeah.
like, I feel like that's a safe
That's
assumption.
real.
Yeah.
Yeah,
Yeah.
the American diet is not
Yeah.
healthy. Like that is like we all know this. They're like, do the Mediterranean diet, have your seafood and your vegetables, and I was like, America says burger, so I definitely I feel that.
No, I think that's true. And then, now it just, I was, what you were saying, Mary, too, before, about the brain, the brain gut association, right? And, even now there's this big initiative on the weight loss medications, right? Have you guys have heard of
Hmm.
Ozempic, for
Hmm.
example, and Trulicity and all that good stuff, Wegovy, all that. What's that's doing is that's a protein analog, and it's called a peptide, and it's called GLP-1, glucagon-like peptide, and that peptide is present in your brain and your gut. So that just lets us know that people have early satiety because of the brain gut
Hmm.
association. So
Mm,
really, you eat with your eyes before you ever eat with your
Hmm.
mouth, right?
mm,
You eat, before you ever actually put the food in your mouth and chew. You're salivating in your brain first,
Hmm.
and
mm,
you're thinking about the food first. So that's why it's very important to have that healthy association with food. And it's easier said than done, but it's a training,
Hmm.
kind of like weightlifting or jogging or whatever it may be, because there's a big brain gut association.
Hmm.
So
mm,
my recommendations is always, for my patients, a general recommendation, not a tailored
Hmm.
recommendation. I think for someone to have a tailored recommendation, they should see like a regenerative, integrative physician, someone who is more holistic approach, but also not really against. In my practice, I'm not against Western medicine, but I'm also not against Eastern medicine,
Hmm.
right? I'm kind of seeing that balance and seeing what the patient needs. But the first thing is, number one is, are you drinking enough water? Right? Are you
That's
drinking
real.
just are you drinking enough water? Right? We say 7 to 8 cups of water. A cup is eight. Ah, here we go. Well, you guys are doing better than me. I have nothing next to me. Dang. But it's like, a 1 cup is 8 ounces, right? And you are you drinking 8 cups of water? In Florida here, I'm like telling them, you double that. You're losing like 8 ounces an
Mm,
hour
Yeah.
because of the heat and the
yeah.
humidity all year round. So, here I tell my patients like 12 cups a day, right? So are you drinking enough water? Because water is, your body's made of pretty much water,
Hmm.
right? And if we're not drinking enough water, then that's the first step to actually being inflamed. The
Mm,
second thing is mindfulness, like just practicing being mindful of where you are in the day, right?
yeah.
In the whole day, like keeping 20 minutes per day, just to be mindful and to allow yourself to just really, you know, think of something that takes you to a happy place, or think of something important for you, or whatever it may be, right?
Mm,
And then with mindfulness, with the whole thing is kind of mindful eating. Mindful eating is like, ask yourself, why am I eating? Right? Why am I eating? Am I really hungry? Or what is it? What is this? How is this serving my wellness long term? Like, say, for example, I'm going out to eat every day. How is this serving my wellness long term? Is this treat worth how I will feel later? Right?
mm,
Maybe I'm gonna gain 2 pounds if I'm eating McDonald's every day for the next 2 weeks versus meal prepping, right? Um, and does this like taste like, how will this provide healing for my body? So I always think of that part is mindful eating. Why am I eating? Right? Why am I eating? Am I really hungry? Right? That's
mm,
the thing. And will this provide healing for my body?
mhm.
And then and then the other thing is, am I fully present while I'm eating? And I think that's the big thing, is that,
Wow.
like, is the big thing of that, am I just like on a rush, driving to work, eating a bar, right? Because I have to have breakfast, for example, and that's the thing. Or is this like a process of actually like saying, okay, I want to sit down and be mindful. And then the
Mm,
other thing is really the general tips, like in general for eating, is like, keep chewing, don't swallow, keep chewing, express, gratitude, even for like where the food came from, for the farmers, for where what had, like, that you can have food on your table. And that's another thing that in part will allow people to actually just eat less by nature, right? Just eat less and more of the right things.
yeah.
Then the other thing that I think is important is the three is the two things that we always, the three things: no drugs, no tobacco, limit your alcohol. Right? That's just like those three things right there. Those Alcohol is a cause of inflammatory processes. Alcohol causes inflammation. We have this thing here that people are like, well, I didn't do anything. I just went out with my coworkers, had 2 drinks, barely ate anything, right? And whatever. But that's inflammation right there. You're literally giving yourself alcohol. And if you're doing this on a daily basis or a weekly basis, it's not even good. Even if you're a weekend drinker, not good, right? So it's that part of resetting the body. We're talking about resetting the
Mm,
body, finding where you're at, and then reintroducing things. Um, and then you got to focus on your drinks. Like, what are you drinking? Like, regardless of alcohol, you have this like easy thing that people are like, yeah, I'm gonna go out to eat. I'm gonna get some nuggets, some French fries, and
Diet
a
Coke.
Coke.
Diet
ah,
Coke.
Oh,
bro, that
oops.
kills me. That kills me. I'm like, what do you mean you're gonna get a diet? Just have the Coke and enjoy your life, right? So that's the thing. Like, it just doesn't make sense if, like, diet Coke is literally worse than normal Coke, and Coke is the worst thing you can have for yourself. So that says a lot, right?
Mm,
Coke is bad. Diet Coke is even worse. So you're really not doing yourself a favor. You're probably
mm,
going to lose weight, or not gain weight if you're eating McDonald's with a normal Coke than with a Diet Coke. Like, you
Wow.
know what I mean? So that's the thing. It's
Wow.
because the brain gut association, your brain isn't you're not, you're going to trick your brain into doing the opposite of what you want, right?
Mm,
They did the studies, you're still going to release insulin with Diet Coke, right? Like, you're
mm,
still going to release insulin, and insulin is what makes you, what stores the sugar molecules into fat, right? It's not, Diet Coke is not going to cause a sugar spike. That's what where people are, but it doesn't matter if it doesn't cause sugar spike. Overall, you're going to still release insulin, maybe not in that hour, but over time, you're going to release
mm.
insulin. That's why people, on average, they're more overweight when they drink diet drinks than normal drinks. And then the second thing is, like, so you want to avoid carbonated beverages in general. Just water. You can add lemon to your water. You can add berries to your water. I tell my patients, put some strawberries, put some lemons in there. And the other thing is, that's really cool what you were saying, Mary, because I do believe heavily in the brain gut association. There is a new thing that people are selling now. It's like, you put this, like, it's like a water bottle, and you put this, like, ring on it, and that ring makes you smell the peaches.
Oh.
It's like a peach. It's like a peach scented ring on the water bottle, and then while you're drinking, you sniff, and it tastes like peaches.
Yeah.
So people,
Wow.
I've never
but
seen that.
it's so, yeah, it's so weird, right? It gives them that fix, but no, you don't need that necessarily, right? You don't know what's in that and this and that, but that tells you heavily how your brain will smell something and taste it
Yeah.
at the same time while it's not in your
Yeah.
mouth.
Mhm.
So that tells you how there is a strong brain gut association. Yes.
I have a couple questions, because you said a lot of things. But first of all, what about everybody's favorite drink, seltzer? So you're saying seltzer's bad? The bubbles, because you said no carbonation. I mean, and that's okay if it is. I just want to know, because a lot of people drink seltzer.
So seltzer is not bad in nature, but the problem with carbonation is one thing, and hopefully Chris is not listening, but I think he can correct me. But the tooth enamel, right? Because I know he's a dentist, but it destroys your tooth enamel.
Even if
So
there's
the
no
problem,
like fake sugars or anything in it, it's still bad for you.
no, the problem is carbonation can lead to leaky gut syndrome. Number one, because of the carbon dioxide in there, and there's so much carbonation, so you're creating these gases and everything, and that can lead to the leaky gut. And then number two is that it does over time ruin your tooth enamel, and that those are the big things about it. So the other thing is, that's not establishing a healthy correlation. I mean, some people in the beginning, that's fine, but we're talking about, if someone is drinking, like 10 Cokes a day, and they're switching to 10 seltzers a day, I'm pretty sure that's a lot better than 10 Cokes a day. But the problem is, over time, you want to switch from the 10 seltzers to maybe 2 seltzers and 8 waters.
I got you. Okay, sorry, I have to go back to one other thing. I know alcohol, obviously, alcohol's bad, but remember you were talking about antioxidants versus oxidants. So we all hear about red wine is antioxidants.
I was thinking that.
So, like, does that include 1 glass of red wine a day, a week? Is that technically going to cause an inflammatory response?
So it's a good thing. Like, the first question is, what is a glass of wine? You guys know, like, how many ounces?
I think 5 technically is like the serving
For
size.
women. Yeah, for I think what it is like is 5 ounces. Yeah, and that's one 5 ounces, I believe, is for wine, and then 1.5 ounces for liquor, right? And the thing is, you have this so 5 ounces. How many people are drinking 5 ounces?
I mean, maybe
Wow.
6.
You think
I
some
don't
people
know.
are?
Like honestly, when we have a glass of wine with dinner, which is not every day at all, it's like
Yeah.
a reasonable glass of wine, because we are very like good adults. Like, we must adult, in the morning, and so it's like 1 glass of wine. But yeah, I'll speak for myself. Yeah.
I don't drink, so
I think it's not, red wine, especially because of the chemical resveratrol, which is, a precursor to something called glutathione, and glutathione is a potent antioxidant in the body. So I think red wine is okay, but the thing is, does it come? This is the problem where we come into play. We're drinking that Coke in the morning for most people, maybe not you, but the Coke during lunch and then the red wine at night. That's where it's a problem. Those two are not.
Mm.
You're actually going to do yourself more of a harm
Hmm.
because you're having too much sugar versus non-sugar. So
Does
I
it?
think if you're living a healthy lifestyle and you're having 5 ounces of wine every night and you're living a pretty healthy lifestyle, that's okay.
Hmm.
But if you're trying to find the root cause for inflammation, it's not okay.
I got you.
And that's
Mm.
the thing.
Hmm.
Yeah.
Wow. Huh, so interesting. I know we're starting to wind down. I don't know, Marian, do you have a last minute question or do you want to throw it to me?
Do you have a burning one? Because I always have
Um,
questions. Yeah.
yeah, let's go with Marianne's burning question.
Okay. Well, burning might be dramatic, but okay. So I've brought this up before. The world of supplements is overwhelming for all of us. So is there one supplement, vitamin, etc., that you would say if you want to decrease inflammation, try this?
um, so that's a really good question. I think the thing about supplements, let me just get started on that and say supplements do not replace whole foods, and not the grocery store. Whole Foods
Yeah.
foods. And and the thing is, supplements do not replace that. The thing is, we always need a supplement vacation regardless of what supplement we're taking. You want to give your body a vacation. You can't be taking a multivitamins are garbage in my opinion, right? Multivitamins are a scam. They don't do anything. They're teaching us to replace whole foods. They're teaching us, and the thing is, people do not live longer with multivitamins. They don't do better and all that stuff. Now, after I just got my little, speech about that, the best two supplements for, inflammation and to target that is going to be turmeric. Turmeric is my favorite, right? If you're just kind of like throwing a blanket statement and you say turmeric is the best anti-inflammatory thing. Turmeric, they did a study versus, just in general decreasing joint pain. Even turmeric, a new study just came out, a very big study on turmeric versus acid blockers like
Mhm.
Prilosec. Turmeric did a lot better with no side
Wow.
effects, right?
Wow.
So you want to do turmeric, and you want to do a high potency turmeric that's 95% curcuminoids, right? Which is going to be the high potency extracted turmeric, and you want it to have, black pepper in it, which is purpurine, to get you better high absorption. That's the best thing right there. Is turmeric for that, and you want a high dose. Um, you're never going to see instantaneous results
Hmm.
with this stuff. You're going to wait about 4 weeks, 6 weeks, 8 weeks. So people think it's like popping an Advil, right? It's not going to be the same thing.
Hmm.
Not the same. And the second one that is definitely on the market a lot, people hear about, is ashwagandha.
Mm.
Ashwagandha is a
Mm.
good one. It's a very anti-stress. It's known to decrease a little bit of cortisol, but the problem is there's not enough randomized studies on it. So if you want the data, you're not going to find the data on ashwagandha, but it's more anecdotal, but it does work, from a lot of patients. I give it to them. The only problem with ashwagandha is it can cause depressive moods if you use it long term.
Mm.
Right?
Mm.
It can cause like things of that nature. So that's why it's more of a like a pulsatile. I just use it like 2 months, 3 months, discontinue it. But turmeric is going to be your winner,
Nice.
pretty much.
Wow. This is so awesome. I'm kind of low key patting myself on the back because the things that you were like, do this, do that. I was like, check, check, check. One of them I was like, oh, Rachel, we did not check. So my takeaway is to check all of the things that Mina told us to do to check our inflammation. And Mina, if people want to get in touch with you or your practice, are there any places they can find you, like on Instagram, social media, the website, anything?
Yeah, for sure. mdprp.com and mdprp PRP, platelet rich plasma, which I didn't go over it, but maybe one other time I will.
Yeah.
And or you can MDPRP Wellness is my Instagram.
Okay.
Um,
Cool.
I don't manage it, but someone else manages it because I hate social media.
I love
But,
it.
yeah,
Love
so
that.
MDPRP.com or MDPRP Wellness on Instagram. And the same one is for Facebook as well. Yeah.
Okay, cool. We'll link it all below. So go ahead, hit up Mina, ask him all of your inflammation questions, or the social media manager, who will then ask Mina all of the questions. And if you're in the Florida area and this is sparking a lot of interest for you, definitely go see him. And I don't know, I'm hearing a lot of get the care that you need. That's something that I was, maybe a background message that I was getting from what you were sharing, Mina. So thank you so much for being here. We really hope that people do connect and ask you and really learn about these things. If you want to get in touch with us, we are on Instagram, Connected Wellness Podcast. We're also on Facebook, Connected Wellness Podcast. If you want to email us, connectedwellnesspodcast@gmail.com. If you want to reach out to me specifically, Real with Rachel Ann on Instagram. If you want to reach out to Marianne specifically, she's at Wabasaba on Instagram. All of that will be linked below, so do not stress at all. And yeah. Uh-huh.
And no, thank you so much for having me. And the other thing, you can always, if anybody wants to email, it's wellness@mdprp.com as well. So
Beautiful. We'll add the email. So you can email, Facebook, Instagram, Mina. And website. I forgot website too. So we got all four covered. And without further ado, I'll hand it over to Marianne to close us out for today.
Thank you so much for listening, for tuning in. Thanks again, Mina. It was lovely to have you and very informative and slightly, I don't know what the word is. I feel slightly attacked. just because, of the seltzer in my pantry and the extensive wine collection in our dining room. But, but I totally hear you and feel you. And I'm a huge proponent of balance, but I understand, like if you're trying to really deal with an inflammation problem, like try to cut out all sources and then go from there and probably see a doctor. And
for sure, reset and then reintroduce. And it's all tailored with your blood work too, in my opinion.
Well, thanks again, everybody, and we hope that you'll be well until next time.
Awesome. Be well, everybody.
Bye.
Bye.